You're listening to the Smith House Adventure Show.
Can you talk about some of the treatments that you offer and kind of the average person and maybe some of the nutrient deficiencies that you see in a general population and some of the more common injuries and things like that, that again, the general population seems to be suffering from more and more?
Yeah. One of the biggest things I see is underlying inflammation, right? Inflammation is and pain, right? So pain is that signal that our body is trying to give us that there's something not working. I kind of explain inflammation like a fire in the body, right? What puts out fire? Water, right? So the body is holding more water. It's showing that there's pain. There's a fire. There's something going on that needs to be addressed. And that inflammation can come out as like an injury, right? You sprain your ankle, there's inflammation, it swells. It also comes out as if there's inflammation in your vessels, right? Then the body is having to try and patch those up. You're getting more cholesterol, patching up those holes in those vessels, right? Then you see somebody with higher cholesterol, or you're seeing inflammation in the gut and they're not absorbing foods and there's food sensitivities, right? If there's inflammation in the gut, there's inflammation in the brain. They're very much connected, right? If somebody has a concussion, that's sure that there's inflammation in the brain. But then we're looking at like, is there mental health? Is there anxiety? Is there depression? These are all symptoms of inflammation in one way or another of the body, making it clear that something's not right. A lot of so gut inflammation, food sensitivities, working on digestion, working on the absorption of nutrients, right? If you can put all the healthy things into your gut, but if it's inflamed and it's not actually absorbing it, you're not getting those nutrients, right? The stomach is taking everything it needs to, or like your intestines and your whole digestive tract is taking all those nutrients you're eating to try and heal itself, and your other cells aren't getting that necessary nutrients to get better, right? If you see an injury that's not healing in that time that it's supposed to heal, it doesn't always mean that you have to take more painkillers, right? And mask that problem, right? It helps, right? In one way, but at some point you have to say, what's the underlying cause of why this isn't getting better and what do we have to do to fix it? So in my practice, I do a lot of orthopedic pain and injury management. I'm seeing acute injuries, subacute, and chronic. I do a lot of regenerative injection therapies to help actually regenerate joints, ligaments, tendons, muscle to help in that healing process. I do use cortisone very rarely, but there is a spot for it, right? There is a spot for medication for people, right? If they're in so much pain that they can't go do those other activities of like daily living, like get out and go for a walk, or they're in so much pain that they can't even go grocery shopping and cook for themselves. We can't expect them to get better if they're not getting those nutrients because they can't even get out of bed. So medication sometimes can get us over that hump in order to then work on those other things that help in their body healing. I'm not afraid to prescribe if I need to, but I do try and take that more natural approach. Is there a supplement we could give them? Is there a nutrient? Can we do like IV vitamin and nutrient therapy, getting those vitamins right into the vein so that those cells get first priority over those nutrients while their gut is healing, right? If we can bypass the digestive system, get those nutrients into the cell, then those cells have that little extra power and oomph to help in that healing process while the digestive system's healing. I do a lot of health optimization. So you don't only have to be sick to come into my clinic, right? There's people that come in and they're like, I'm actually doing quite well, but I have a history of, inflammation, or I have a history of high blood pressure, or, there's a family history of a certain medical condition. I want to try and prevent that. What can I do to continue to take care of my health so that I don't go down that same path? I do a lot of digestive health. As I said, I do IV vitamin and nutrient therapy. I do a lot of immune support. So even just during cold and flu season, right? Like we all get colds and flus, but how do we actually support the system to be able to fight those and continue to, you don't get like that cold that everyone lasts, 3 or 4 days and you're out for, a month or two just because your body doesn't have those resources to heal. Those are my great things to do. Those are fun things to do. I do some aesthetic injections. So for like Botox, I also use it for like medical purposes, for migraines, for, if there's a lot of tension. There are other injections that I prefer to use over that. But if it's a last resort and we can't figure out how to fix their migraines, they've tried medications, they may have tried some of the other injection therapies I do to decrease inflammation around nerves or to loosen those muscles, then we may have to go to a Botox. But I do hold that certification. I do a lot of ozone therapy. What else do I do? I have my list here just in case I forgot. But so I see a lot of, things, in regard to the regenerative injections, working on whiplash after a car accident, right? So whiplash is one of those things that, you hear somebody had a car accident years ago and they still are struggling with neck pain, right? It doesn't mean the body hasn't healed it, but it also is that those muscles have remained tight to protect an injury like that from ever happening again, right? Those muscles are like the older brother or, that older sibling that will always protect their younger sibling, or the more delicate, fragile structures like, ligaments and the spinal cord. I treat a lot of joint injuries, so shoulders, elbows, wrists, knees, ankles, hips. I do spinal injections, so like helping ligaments through the spine. I can pretty much inject head to toe. Knees, hips, ankles, ligaments. I do a lot of arthritis, and if there's like joint degeneration, there's injections that we can do for that. But again, it's everybody. It's not one size, one treatment fits all. So I'm working with those patients also, what's in their budget, how long have they had this? How is it affecting their life, right? You can have somebody with a bulged disc that has no pain, and you can have somebody with what looks like on imaging, a very little bulge disc, and they are debilitated, So you got to meet the patient where they're at, both with imaging and then also how their symptoms are affecting their daily life. I help with like dislocations, tendinitis, joint pain. I do a lot of TMJ. I do a lot of jaw injections. I actually worked with a biological dentist for a while. He taught me a lot of different things about dentistry. And then I was able he would fix, the jaw and the bite. But if that jaw isn't set right, everything else in the body also has to shift. And so then I was doing all the injections to kind of help stabilize everything else once their jaw was actually in alignment. In regard to aesthetic injections, so that's kind of my regenerative injections. For the aesthetics, yes, I talked about Botox. I also do stuff for hair loss, actually trying to regenerate that hair follicle to start producing hair again. And that's using your body's own blood and platelets to actually stimulate new hair follicle growth. Of course, fine lines and wrinkles, building collagen, right? Making sure that the skin is healthy. And we do that we can do it with injections. We can also do it with diet. Maybe there's some different face treatments we can do. Acne, skin rejuvenation, skin toning. I treat a lot of nerve pain as well. So going back to those regenerative injections, so like nerve pain, neuralgia, surgical scars. When there's you can kind of use my blazer as it. So if there's a hole or a surgical scar, right, in order to actually heal that up, it's like having a hole in your shirt. But that surgical scar bunches everything up. And all the layers between the outside where it was surgically cut and that inner layer that you have to heal all gets bunched up together. And so when you bunch it all up like this, all of those layers are together. Nerves get caught in it. You're not getting that flow of each different layer of tissue moving on its own. So I'll actually go in with a needle and actually kind of work all those layers away from that surgical. It's almost like it's all pinched together, and get each layer moving individually, which allows nerves to regenerate. It allows more movement, right? Like if I do this, even the bottom of my shirt is going to move, even though I'm actually up here. And the same kind of thing happens with a scar. So I'm actually helping to kind of release that scar, and whether it be after a surgical scar or like a bad accident. C-section scars are a big one. And because all of those layers have to be, sewn together to fix that wound. And then I actually go in and help, and it really helps, patients be able to move better, because it's not like there's like a stake here that's preventing that fascial movement. I treat a lot of headaches and migraines with something called neural therapy. So we're actually trying to decrease inflammation around those nerves that are actually kind of triggering that headache. I do a lot of trigger point injections to release muscles, get them from being tight and fired like this. We get them to fully contract where they actually have to release. And that really helps to kind of reset how that muscle is communicating with the rest of the body. So I do a lot of trigger point injections. And then, of course, like with pain management, like sports injuries, sports optimization, I do acupuncture trigger points to help release those muscles. I do cupping, I do adjustments. Again, cortisone injections, hyaluronic acid injections, which is actually like a gel solution into the joint to actually give that buffer. If it's bone on bone, right, where there should actually be synovial fluid or like a fluid in there, we can actually put an artificial fluid in there that allows that joint to move better without, being right bone on bone with each other, and which again causes pain, right? And then, of course, I do lab testing. So like food sensitivity testing. I can run all different like Life Labs tests to run any kind of blood work that the patient needs. Of course, people pay privately for that, but we are able to run more testing than, say, other practitioners can run, but you pay privately for those tests. I do treat some women's health, like physical exams, breast exams, pelvic exams. Of course, I do physical exams. So if any heart, lungs, abdomen need to be listened to. Again, I'm helping with mood support, mental health. I still contract out and do some work with addiction, which I have a very soft spot in my heart for kind of helping people with that. I do a lot of the injection therapies as people are coming off, whether it be a prescription drug or a recreational drug, and those ones that are trying to just reset their cells to get into a better, more youthful form of that cell than it was when they were struggling with addiction. And I mean, that's not an easy one. It's not a black and white of you get an IV and everything's better. But, my undergrad's in psychology. And so I have this like love for helping people that want to get better in whatever aspect that is, At my New West clinic, I do a lot of like weight management and weight loss support. So that, between my Chilliwack clinic, where I do a lot of pain management, in New West, I do a lot of weight loss, but I still see pain as well, right? Because when people, they have that pain, they need to lose weight. So I'm helping lose that weight. And then I'm also helping to fix those injuries that have, kind of been a burden for them for quite a while. I help with sleep support, right? If you're not sleeping, you're not healing what needs to be healed, right? You're not giving your body that break. And then, of course, I do hold my prescription license to write a prescription when needed. But I do try and do it as naturally as I can. And that's about it. I'm sure there's more, but that's...
Thanks for your time. Please like, subscribe, and comment to help grow the show. And remember, get back up.